friends, welcome back to the Blackboard. And as talked in the last video, we're doing a playlist of suspected cancer pathways, and we'll be looking into the 2 week wait referrals and what qualifies for these referrals according to the NICE guidelines. So we'll start off by the suspected cancer pathway, and we'll begin with respiratory today. When we talk about respiratory medicine, we'll in particular be dividing the screen into half. So we'll be talking about lung cancer and mesothelioma. And we'll look into, as a GP, when you're in the GP surgery, when would you want to be thinking along these lines? When we talk about lung cancer, we'll talk about things that will make us consider 2 week wait referrals. Now, these are referrals that we've talked about where you would send the patient to respiratory medicine as soon as possible, and the specialist will have a look into the patient in less than 14 days. We can also have a look into patients that require an urgent chest x-ray. So if you were to see these patients, you're like, you know what, they don't qualify for the 2 week wait referrals, but they might qualify for urgent chest x-rays, and then you can always consider chest x-rays. 2 week wait referrals, actually we're going to erase this off, give a little bit more space for 2 week wait referrals for urgent chest x-rays, so that we can write quite openly. Now, 2 week wait referrals as per respiratory are very, very simple. It can either be number 1, which is chest x-ray findings suggestive of cancer, or you can have anybody greater than equal to 40 plus unexplained hemoptysis. So these are like go-to things. If you find these, you just right away bother the respiratory medicine people and not think about anything else in terms of like x-rays. However, if you have patients, you can consider along the lines of urgent chest x-rays for these people. So it could be anybody who's greater than equal to 40 years, has 2 of these, or anybody who's a smoker plus has 1 of these. So anybody who's greater than 40 and has 2 of the following, or is a smoker and has 1 of the following. And what are those 5-6 things? That would be shortness of breath, cough, chest pain, fatigue, loss of appetite, and last but not the least, weight loss. So anybody who's greater than 40 and has 2 of these 6, or anybody who's a smoker and has 1 of these 6, qualifies for an urgent chest x-ray. We can consider a chest x-ray for anybody who's greater than 40 years and has 1 of the following. And these are, I think, the most tricky ones. These include recurrent infections, lymphadenopathy, we can have clubbing, chest signs, or thrombocytopenia. We can always consider chest x-ray in such people. Now, this is pretty much the 2 week wait referral for lung cancer summarized in one slide. We can either go down the pathways for 2 week wait referrals, we can go down for chest x-rays that could be urgent or they could be considered. 2-week wait referrals would be chest x-ray findings, so definite cancer, or anybody who's greater than 40 and has unexplained hemoptysis. Urgent chest x-ray would be either 40 years plus two of the following, or smoker plus one of the following. And the six things are shortness of breath, cough, chest pain, fatigue, loss of appetite, weight loss. We can consider chest x-ray in anybody who has recurrent infections, clubbing, cytopenia, thrombocytopenia, lymphadenopathy, chest signs would be the easiest ones to consider into. Now, when we think about think about mesothelioma, we can again divide that off quite similarly. So, like 2-week wait referrals, we need to consider urgent chest x-rays, and lastly would be routine chest x-rays. Or we can consider chest x-rays in these ones. Let's put it this way. So it would rather be basically 2-week wait referrals, anybody in which we should consider urgent chest x-ray, and we can only consider chest x-ray. These ones are, this is definite chest x-ray, and that is just consider. Now for 2-week wait again, it has to be definitive. So chest x-ray findings. For urgent chest x-ray, it's quite the same. Plus, anybody who has asbestos exposure gets a chest x-ray. So irrespective of the signs, if somebody has asbestos exposure, they get the urgent chest x-ray. For consideration of chest x-ray, it has to be quite similar to what we have for lung cancer. So that's 40 years plus one with either clubbing or chest signs. And that completely is 2-week wait referrals for lung cancer, jotted down in one slide. We've talked about or let's put it this way. This is how we put down respiratory problems or respiratory cancers in one slide. We've talked about lung cancers, and we've talked about mesotheliomas. Okay, we'll be going forwards doing a few more. For example, we'll be doing gynecological cancers. We'll be looking into a few pediatric tumors. We'll also look into breast. Till now, this is what I have from the NICE guidelines with suspected cancer pathways, and this is for the respiratory cancers. Bye. Don't forget to like, subscribe, and share, please. Bye.